Hello, my name is Andreea Cetean and I'm a third-year student at Cluj School of Public Health. Today, I will present you the preliminary results of my systematic review on leadership perceptions, behaviors, and practices in dentistry. I will start by giving you an overview on what leadership is, what is the difference between leadership and management, and present to you some reasons of why leadership is important in dentistry. After that, I will present to you the methodology of my research, what my preliminary results are, and discuss upon them. I will also point out to the limitations of my study, but also to the implications for future research in the field. Leadership is a process whereby an individual influences a group of individuals to achieve a common goal. Thus, leadership represents a mix of traits, qualities, and behaviors that the leader has, which enable the participation, development, and commitment of the followers to the organization. Effective leadership is characterized by three main components: innovation, quality, and business culture, which require different set of skills. Effective leadership involves combining leadership, management, and entrepreneurship skills so as to achieve the goals and objectives of the organization. Leadership should not be confounded with management, though. Leadership occurs at the strategic level and focuses on enhancing effectiveness, while management occurs at the operational level and focuses on improving efficiency. Roughly translated, leadership means doing the right things, while management means doing the things right. A successful leader in the dental practice is capable of recruiting and retaining expert staff, but can also create an environment in which high-quality care and patient satisfaction are esteemed. Studies found that dentists place great value on being good leaders of their practices and on being recognized by their patients as good leaders. Research also found that dentists perceived being recognized by their patients, staff, and other dentists as experts in oral health care as indicators for leadership. As dentistry has become more evidence-based, dental practitioners are expected to become leaders in their practice. The lack of leadership training has resulted in dentists being unable to effectively lead their teams, to ensure an efficient organizational culture in their practice, and to deliver high-quality care for their patients. The objective of this systematic review is to provide an overview of the research documenting leadership perceptions, behaviors, practices, and barriers in dentistry. A search was performed within three databases: PubMed, ScienceDirect, and Scopus, by using the following syntaxes: leadership and dentistry, leadership and dentists, leadership and dental practice, and leadership and oral health. This flowchart presents the process of identifying articles for the review.
The initial search criteria identified 880 articles, 378 being from PubMed, 166 from ScienceDirect, and 216 from Scopus. 260 articles remained after applying the inclusion criteria: research documenting leadership in dentistry, written in English, published in peer-reviewed journals, and access to full electronic text. 199 articles remained after scanning for duplicates. For the purpose of this study, only original research was considered. Thus, 123 articles remained and were scanned by abstract title and keywords: leadership, lead, leader, dentists, dentistry, dental practice, oral health, and oral healthcare. 11 articles were found relevant and thus included in the final analysis.
Leadership was studied from the perspectives of dental practitioners, dental academia, dental leaders, and dental students. The studies included in the analysis were performed in the United States of America, the United Kingdom, and Japan. Leadership and leadership training were perceived important across all groups. Both practicing dentists and dental students rated leadership as important or very important. Dentists also pointed out that it was crucial for them that their patients and peers regarded them as leaders. However, significant differences were observed between males and females, who had greater scores on the importance of leadership than their male counterparts. Transformational, clinical, and entrepreneurial definitions of leadership were more common in the studies analyzed. Dental students were more likely to refer to leadership as being transformational and believed that leadership could be learned. Dentists from Japan were more likely to refer to leadership as clinical leadership at the practice level and to highlight the importance of effective diagnosis and treatment. Entrepreneurial leadership was also mentioned by dentists who expressed tensions between managing the business and being a leader for their staff and patients. Different leadership behaviors were noted across studies. Some dentists believed that teamwork and empowering staff to participate in the management of patient care as leadership behaviors, while others stressed out on the importance of effectively managing conflict. Leadership practices identified in the studies were related to practice management, membership in dental organizations, and activities in the community. Dental volunteering and holding policy-related positions were also considered leadership practices in dentistry. Main barriers to leadership for dentists were the lack of training, financial and time constraints, family obligations, and government reform. Moreover, the lack of confidence in their leadership abilities or the lack of interest in engaging in leadership were also reported by dentists. The studies included in the analysis had a small explanatory power, and their results might not apply to a larger population. To conclude, leadership in dentistry has many dimensions and varies across regions or stage of professional development. Future research is needed in the field in order to get a more comprehensive image of leadership in dentistry. However, this present review also highlights the potential of including leadership training in dental education, as it can prepare dentists to meet the current demands in oral health care and to further advance the profession.